Namaste. I'm Dr. Nikhil.
I'm Dr. Amrita.
And we are from Sharada Ayurveda Medical College and Hospital, Mangalore. Today, that is 29th October, is World Stroke Day. And stroke is the fifth main cause of death right now.
Knowledge is always great. If we have knowledge, we can surely avoid the disease.
And we are here to discuss furthermore about stroke and what are the most commonly asked questions, and hence we thought of actually clearing your doubts and of course spreading the knowledge, and of course sharing your knowledge is also very, very important. And hence, doctor, what is stroke?
Stroke in common language is paralysis. That means either the weakness or the complete loss of movement of one part of the body, that may be one hand, one leg or both the legs, or one hand and leg, that we call it as stroke or paralysis.
I think we often get most of the patients having affected with half part of the body.
Yeah.
So most of the time it will be left half or right half of the
Yeah.
body. And what is really the cause for this stroke?
As we all know, brain is the functional unit of the human body. That means to say, brain controls all the activities of our body. So when there is a loss of blood supply to the one part of the brain, it may be a minor small part of the brain, when the blood flow is stopped, it may be because of clot or it may be because of hemorrhage, then the person suffers from stroke.
So hemorrhage means it's like the rupture of a blood
Yes,
vessel,
yes.
isn't it?
There are small blood vessels which supply the brain with the blood. So blood supply to the brain is very much important. Even for a second, if it is stopped, then the person suffers from stroke. So the clot, it may be the blocking of the blood supply, or when the, as you said, when the rupture of the artery is there, then the person suffers from stroke.
So can I relate? I would just sort of asking one more question. So if we come to know that mostly we get patients like, okay, and we have a block and some angioplasty was done. Is it somewhere related to the similar part? Is that a kind of a clot that happening in the brain?
Yeah, of course, that is the same thing. So if there is increased cholesterol, say for example, which is the most common cause, and if it happens in heart, we get a heart attack, and if that happens in brain, then surely it is paralysis.
Fine. So is there any reference in Ayurveda regarding the stroke or paralysis as you have?
Yeah, sure.
said?
We get a reference in Ayurveda, and since in Ayurveda we get terminologies in Sanskrit, they call it as Pakshaghatha. Paksha means it is the half part. Aghata means some sort of discomfort. It may be the loss of movement, or it may be complete loss of movement, or some sort of less movements.
So it's we can say in other words
Weakness.
it's a direct relation.
Yeah,
Whatever.
it is a direct relation. Exactly whatever that is explained in modern science, the same explanation we get it in Ayurveda too.
Okay, so by any chance can we prevent it, or is there any category of people who can be called in or put in a risk group?
So on this every year when we tell about the World Stroke Day, we will be having certain themes.
Yeah.
When we look into the ratio, about 1 in 4 adults suffer from stroke. So hence prevention, this year's the theme is prevention. Hence we will be talking more about the prevention. Prevention is very much possible because of our lifestyle, because of our food habits, and because of our addictions. We are moving towards stroke. Otherwise, in olden days, it was like the disease of old age. But at present, it is the disease of all ages. Hence, prevention is truly possible.
And we in Ayurveda, of course, give so much of significance, or we emphasize more on prevention.
Yeah. Swastasya swasthya rakshanam maturasya vikara prashamanam. That means first comes the prevention and next is the curing the disease.
Yes, because prevention of any disease, you mean to say,
Yeah,
right
it's
from
more important.
Yeah,
Yes.
exactly. It's all about being more healthy, and
Yeah.
we can postpone the event of aging or any disease for that matter.
So when it comes to stroke, prevention is very much important, and it is possible by keeping ourselves active. That means stay active so that you can prevent stroke. As well, when it comes to Ayurveda, we have a lot more things like Panchakarma, that is detoxification therapies. Food is the main thing, which we call it as Patyahara, and we also go for yoga and pranayama.
We generally say, okay, we go to a cardiologist, or we get annual health checkup done every year. That's like, of course, very important. So how do you categorize, like what age group of people are more likely prone, or are there any risk category of people who are
Yes.
likely to get this
Yes,
stroke?
that is very much important to know because of our habits. Like it may be the alcohol intake, it may be the sedentary lifestyle, it may be the person who is smoking, who is taking tobacco, and who is already having diabetes and hypertension. Most of the time, what happens is the people go to a doctor for hypertension and this diabetes. They prescribe them the medicine.
Very true.
They what they do is they take it for long and they don't go for a regular checkup.
Exactly.
They'll be taking it for many years, and sometimes that medicine might have stopped acting on them, and maybe they are in a high level of sugar level, or it maybe it is increased hypertension, like that. So they won't be knowing it, and hence they may land up in stroke.
Exactly, because even we get patients who say that, okay, we had been to a doctor almost a year back, and they bring us with a lot of reports.
Yes.
Maybe simple lipid profile reports, or some other urine analysis, so whatever it might be.
So when you see them, they'll be taking medicine for years,
Exactly.
and they won't be going to a doctor for regular checkups.
Regular follow-up
Yes.
is like hardly
Yeah.
seen. Very few number of people or number of patients will always
Yes.
go to a doctor
Yeah.
and get the regular checkup done, and try to know that if things are in place, if they fall in the normal limits, and all those things.
Yes.
So when I say that, do you think that is there any kind of a resistance that can be developed by continuing a medicine?
Yes, according to Ayurveda, when we take medicine for long duration, it acts as a food. So regular checkup is must, so that you should know that whatever the medicine that you are taking is really acting on you, whether it is controlling your sugar level, whether it is controlling your hypertension, whether it is maintaining your body health is most important, and hence regular checkup is the must, and this is one of the main thing which you can do to prevent the forthcoming stroke.
So what age group are more likely to get affected?
As I said earlier, it was the disease of old age before, and at present we see stroke in early
as
30s.
young ages, like
Yeah,
what
30s.
age?
We see it in 30s.
Oh, we see it.
Yes, we see it in and what may be the cause? It is the cause. The main cause is our lifestyle. In lifestyle, it is like we lack in doing our exercises.
Exactly.
And we completely depend upon the different food habits.
Right.
So it is like being in India, we had a traditional system of food that we have forgotten, and we completely depend on westernized food habits. I don't say that those foods are bad, but those food when taken in India, it doesn't suit us. And because
Okay.
of that, we land up in many diseases. We take lot of viruddha ahara is a one concept, and it is too much to explain. But in short, if I have to tell you that too much dependency on Western medicine food habits, doesn't suit us. It may be intake of pizza, burger, or it may be the soft drinks, or it may be like viruddhahara, what I said, that pani puri, sev puri. This is
Okay.
Indian one, but still it doesn't suit us because
Doesn't
it
we
is
always go along with
viruddha. Yes, it is viruddha, opposite to our body. And so what I tell you is better to go for a traditional food items, and of course we need change, and for that change sometimes once in a while this is done.
So what we recommend is, like, of course, like once in a while, as doctor has rightly said, maybe once you go in a month, you can go. You go to some other good restaurants. If you want to try something, it's fine. We can very much give ourselves an excuse, and we can keep something good for our tongue.
But
Okay.
if at all you cannot avoid all these things, then keep yourself very much active. Whatever the calories that you have taken, you just burn it out with doing yoga and pranayama.
So that's really a good point, because like most of us, due to our lifestyle, I mean to say, due to our busy schedules, we will not be finding ourselves a time to do exercises.
Yes, yeah.
So what would be the ideal hours, or like is it like 30 minutes of walk, or what would you suggest
Yeah,
for this?
that totally depends upon how much your weight is. But still, in general, I can say that at least for half an hour, you just have to do some exercise. It may be yoga, exercise, or just mere walking, and that is that is recommendable. And whatever I say is not the standard thing. It completely, that's what I said, it completely depends upon your weight and your metabolic rate. Everything the doctor will give you the perfect thing, that how much hour you have to do the exercise. You have to go to a doctor to know that how much time it needs. But in general, it is about half an hour.
Okay, doctor, how can we? What treatment can we do? So, if a patient is brought immediately to the hospital, to an Ayurvedic hospital, and then is there any different, or like we have to go to an allopathic hospital in the initial stage and then get some immediate treatment, and then we have to come?
What exactly happens is, when a person suffers from stroke, usually people have an idea that they have to rush to the hospital, and most probably the thought of people is it is like going to a modern hospital.
True.
And I don't say that they should not go. Since the technology is available, it will be very good if they go to a hospital and take the MRI and come.
Exactly. Like MRI findings are very
much important.
Very
because
important.
The technology is there. It is not like it belongs to modern system of medicine. This is the improvement of medical engineering.
Exactly.
Okay,
True.
this is not for if you are going for a X-ray, if you are going for a MRI, or if you are going for any lab test. It is utilization of medical engineering.
Exactly.
Okay.
Right.
So when they go for that, and when they take a MRI report, it will be very helpful for us to go for a treatment. And we have different varieties of treatment depending upon the cause of stroke.
Okay.
As I said earlier, the medicine depends upon whether it is a hemorrhage or it may be the
what is it called? A complete blockage of blood vessels.
Totally, the treatment varies depending upon that.
Okay.
So if they go to a hospital and take those things, it's fine. If they directly come to us, then also it is fine, that we have treatment for immediate stroke too. But meanwhile, we advise them to go for MRI scan.
Yes. So based upon the MRI report, we will be definitely taking like what as you have told me earlier. We will be just deciding what treatment in what different.
But in general, if I have to say, we adopt Abhyanga, Dhara, Nasya, and different varieties of sedation therapies.
Exactly.
We even go for Rasayana therapies, and physiotherapy is must. So this is a combined thing. It is not like a stroke is treated with just a simple medicine. It is a combined
approach.
Yes, approach. It is a both external treatment, internal medicines, yoga and pranayama, because once the person suffers from stroke, it is like they'll be mentally disturbed.
Right.
For that, the pranayama helps a lot. And sometimes if it is needed, we even go for counseling, because that is also needed. Unless the person has positive attitude, no medicine or no treatment can treat the person.
Yes, that's very important. That's really important.
That's why in our hospital, especially in Sharada Ayurveda hospital, we have an integrated approach. That means whoever the person comes, it is internal medicine, panchakarma therapies, if needed counseling, yoga and pranayama, and as well as physiotherapy. And the most important thing is food. Patyahara, that also we adopt here.
Okay, so what or how would you like to conclude, like, or what message would you like to give to the society on this World Stroke Day?
Yes, on this World Stroke Day, prevention is the thing that the message has been given by WHO. And what I would like to tell you is, stay active, start moving so that you never stop moving. That is what I would like to tell on World Stroke Day.
Well, I believe that this session was pretty informative for you. Share your knowledge and stay healthy always.
Thank
Namaste.
you.